Hello everyone. Today's tutorial is about one of the most recent and essential skills in medical affairs, which is setting the right metrics. This is very important, not only to track our activities in medical affairs, but also to showcase the value, the impact of these medical activities. Years ago, we didn't talk about metrics in medical affairs at all. In fact, in many organizations, measuring medical activities was discouraged because there was a real fear that it would look like commercializing the scientific and medical work. But today, the landscape has changed completely. Don't get me wrong, medical independence is still protected more than ever. But at the same time, we are being asked to clearly demonstrate the value of what we do. And the only way to do that is by setting the right metrics. Metrics that can help us measure success, show impact, and highlight how medical affairs contributes to patient care, to scientific advancements, and to the organization's overall strategy. So in this session, we are going to simplify the different types of metrics you can use in medical affairs. And we will explain why they are absolutely critical for your success, both today and in the future. Let's start by answering a very important question. Why do we need these metrics initially? And why are they absolutely critical? 5 reasons. First, as we mentioned in the beginning, metrics allow us to showcase the value and the impact of the medical and scientific work we do in the industry. Without metrics, our contributions stay invisible. With metrics, our work becomes clear, measurable, and appreciated. Second, if we wanted to use data in our communication, what we call data storytelling, metrics become an essential part of that story. Because when we communicate without solid, clear metrics, our message becomes shallow, unsupported, and sometimes meaningless. So metrics bring credibility, bring weight, and they bring clarity to our narrative. Third, metrics help us align with the organizational expectations. Leadership wants transparency. They want to understand what medical affairs is doing, how resources are used, and where the scientific value is being created. Metrics allow us to speak the same language as the broader organization. Fourth, metrics guide our strategic decision making. When we measure the right things, we can see what's working and what's not, and where we need to focus our time and effort more. This helps us plan better, prioritize smarter, and deliver strong scientific outcomes. The fifth reason is that metrics support our future growth and credibility as medical affairs professionals. When everything is measured and documented, we can demonstrate continuous improvement, show progress year over year, and build trust across every function we work with. So metrics are not just numbers. They are the foundation of value demonstration, strategic communication, and long-term success in medical affairs. And to keep things simple, we will group everything into just 2 categories. The first category is the quantitative metrics, and these are the easier ones. They are the number we can count. Things like the number of engagements, the number of training sessions, the number of materials that we delivered. These numbers matter because they show the activity levels and how our resources are being used. But the second category, qualitative metrics, is where the true value lives. Qualitative metrics capture depth, capture quality, scientific contribution, and the strategic impact of our work. And this is exactly where the medical affairs leadership is shifting to focus. They are no longer asking how many activities did we complete. They are now asking, what difference did these activities make? Qualitative metrics help us to show how our engagements influence the strategy, how your insights shape the decisions, how your education activities supported healthcare professionals and the clinical practice, and how your scientific work created real value for patients and for your organization. This is where medical affairs is heading now, toward proving meaningful impact, not just measuring the productivity or the activity. Now, let's begin with the quantitative metrics, because they are, as I mentioned, usually the easiest to define and measure. Quantitative metrics focus on the countable side of our work, the activities we perform, the interactions we conduct, and the outputs we deliver. They help us to establish a baseline of productivity and show how our resources are being used throughout the year. In medical affairs, these quantitative metrics cover almost every part of our daily operations. For example, field medical engagements. We can count how many scientific discussions were held with the healthcare professionals or key opinion leaders, how many were face-to-face, virtual, at congresses, or through follow-up educational conversations. Another example, when we talk about generation of medical insights, how many insights were collected, documented, and submitted on time. The volume shows how active the team is capturing field intelligence. And if we go to medical educational activities, the number of events delivered, number of webinars, symposia, scientific roundtable discussions, clinical updates, or disease awareness programs. Advisory boards, how many advisory boards were conducted, and how many experts participated, and how many deliverables were produced out of this advisory board. Internal training, another example, the number of scientific trainings delivered to different teams, cross-functional colleagues or customer-facing teams. And if we want to talk about even promotional materials or medical materials that we created, of course, promotional materials that we approved or medical materials that we created, how many slide compendiums, how many scientific narrative or frequent asking question documents or objection handling documents that we created, or new educational materials even. When it comes to evidence generation activities, how many investigator-initiated studies were reviewed, how many non-interventional studies were supported, how many real-world evidence projects were initiated, how many publications were submitted. Just counting the numbers. Another example, Congress activities, the number of posters, abstracts, oral presentation that you delivered at scientific meetings, local, regional, international. Even the cross-functional contributions can turn into quantitative metrics. How many scientific reviews were completed for promotional materials? How many compliance checks or medical approvals were granted? These quantitative metrics are extremely useful. They help teams to understand the workload, ensure operational visibility, and monitor how medical plans are being executed throughout the year. But while these metrics tell us how much activity was done, they don't tell us the value behind it, which lead us to the second category of metrics, the qualitative metrics in medical affairs. If quantitative metrics tell you what was done, qualitative metrics will explain how well it was done and what impact it created. And this is exactly where our leadership attention is shifting across the entire industry. Today, medical affairs is expected not just to be active, but to be strategic, insightful, and influential. Qualitative metrics help us to demonstrate scientific value, shape the internal decision making, show the true contribution of medical affairs to clinical practice, patient care, and the organization itself. Let's look at how these qualitative metrics appear across the major activities of medical affairs. First, the quality of scientific engagements. Instead of counting how many meetings you had with your key opinion leaders, qualitative metrics assess what actually happened inside those discussions. Did you address priority scientific topics, for example? Did you uncover the unmet needs or evidence gaps? Did you had the conversation that advanced your understanding of guidelines or of clinical practice? And most importantly, did the healthcare professional find your scientific contribution relevant and valuable? And here, in order to collect these metrics, you can use surveys, feedback forms, different tools to capture these insights. Second, the strategic value of the insights. Again, the quantitative metrics count the number of the insights, but the qualitative metrics look much deeper. Like, for example, were the insights actionable? Did they influence the internal decision? Did they reveal some sort of emerging trends or any early signals? Did they help to refine your medical strategy? And here, you can use different documentations, meeting notes, and feedback to collect these qualitative insights. Let's visit another area, the scientific quality of your medical education. Here again, it's not about how many webinars or how many roundtable discussions were delivered. It's about the scientific depth, the clarity of the content, and whether the session truly addressed the educational gaps of the healthcare professionals. For example, did the audience leave more confident in a new approach? Did the session reduce misconceptions or barriers? Did it support better clinical practice? These indicators show whether your educational efforts actually improved patient-centered knowledge. Again, surveys are very important in this area, and also it is important to know how to ask the right question in these surveys or forms in order to capture the meaningful metric that you are searching for. Let's go to another area, which is advisory boards. How can you use the qualitative metrics? Here again, you also look beyond the number of boards conducted or the number of experts who attended. You are looking for questions like, did the experts' feedback shape your strategy? Did it help to clarify unmet needs or evidence priorities? Were the recommendations incorporated into your future plans? Here you need to use questionnaires and document the discussions in the final advisory board report. Another area, the quality of medical materials. The qualitative metrics here help you to evaluate the scientific value of your content. For example, is the material contained accurate and clear information? Is it aligned with the priority messages? Is it genuinely useful for healthcare professionals or internal teams? Does it support cross-functional alignment? Here, audit reports and approval rates can be your source of these metrics. For example, if you have 0% rejection rate of your materials, this indicates not only the scientific value, but also your compliance. Another area, which is the influence on evidence generation. Here, the qualitative metrics highlight how medical affairs shapes the research environment. For example, did field insights reveal new evidence gaps? And that these gaps were addressed, and how? Did the key opinion leader feedback refine any protocol? Did the scientific discussions validate or challenged assumption in the study design? Documenting these indicators will show how you connect the real-world practice to the internal evidence strategy. Another area, contribution to cross-functional strategy. Here, leadership pays close attention to this area because it proves that medical affairs is not operating in isolation. So here you need to get metrics to answer the question, did your scientific recommendation influence the brand or launch planning? In most cases, it does. Did the team rely on your expertise during decision-making cycles? Did you help shape the value messages or patient journey insights? And so on. Another area which we cannot miss is patient-centered impact or the patient awareness activities. And these metrics are harder to quantify, but they represent a very important area for medical affairs. Did the work that we do address real-world barriers for patients? Did it support early diagnosis rates or better adherence? Did it provide insights that ultimately improve the patient outcomes? While these metrics sound difficult, you can still gather them by, for example, anonymous feedback forms distributed to different key opinion leaders. So, to put it all together, qualitative metrics are the indicators that leadership remembers. They help you to answer the real questions. Did our work matter? Did it influence decisions? Did it improve scientific understanding or patient outcomes? Did it support long-term strategy? Quantitative metrics show the activity. Qualitative metrics show the value. Think of them like this. And today, value is exactly what defines a successful medical affairs team. Before we close this session, I wanted to take a moment to talk about something extremely important: the role of metrics in our internal communication. Because setting the metrics is only half of the job. The real impact comes from how we communicate these metrics, both before an initiative starts and after it is completed. And this is exactly where data storytelling becomes essential. Let's talk about communicating metrics before an initiative begins. Anytime you plan a medical activity, whether an educational program, advisory board, scientific campaign, or even a field medical activity, you need to set expectations clearly. You wanted to explain, remember we are before the initiative, you wanted to explain what success looks like, which metrics you are going to track, why these metrics matter, and how they connect to your medical strategy. For example, if you are planning a series of educational sessions, your pre-initiative communication might include the scientific or educational gap you wanted to address. What else? The qualitative metrics you will assess, like scientific relevance or healthcare professional feedback. Also, it can include the quantitative metrics you will track, like attendance, of course, or the number of sessions and the expected impact on the strategy. Sharing this upfront helps everyone understand why the initiative is important and what outcomes truly matters. And when communicating metrics after the initiative is completed, you can start with what we planned, the goals and success metrics you defined earlier. Then you can move to what we delivered, your quantitative and qualitative results. And finally, you can explain why impact was created. Changes in knowledge, new insights, patterns you discovered, or internal discussions or internal decision your work influenced. This simple before versus after structure shows transparency, alignment, and maturity in how you communicate value. One last point when we talk about data storytelling in medical affairs, and we have multiple tutorials in this regard and this important area. Metrics here are essential part of the data you use in your stories. And how can you do this? Let's say you are drafting a communication and you want to include your metrics. You can follow a very simple structure. Step 1, start with the context. Why was this initiative needed? Step 2, show the metrics clearly, both the quantitative and qualitative. Step 3, explain what the metrics mean. What patterns did you observe? What signals emerged? And step 4, highlight the impact. How did this influence the strategy? How your work influenced the decisions or the clinical understanding. Step 5, close with next steps. What will happen in next? What actions you will take in moving forward? This structure works for everything, trust me. If you are talking about a congress activity, a publication, training session, key opinion leader engagement, or advisory board, if you follow these 5 steps in your communication, you have utilized the metrics, your message will be meaningful, clear, and showing the impact and value. Okay, finally, why does this all matter for medical affairs leaders and leadership? Because today they are expecting us to communicate 4 things. The why we did the initiative, the what happened, the so what, the impact, and the now what comes next. When you communicate metrics before and after every initiative, and you do it through strong, simple storytelling, your position as medical affairs colleague will change into a true strategic partner, not just operational function. This is how you build credibility, visibility, and long-term influence inside your organization. I hope these insights were useful. Thank you everyone, and see you next time.